Chapter 15, not so bad. Not as complicated as some of the other chapters. So let's look at the things we're going to go over with this chapter. The gas exchange between air and blood, how the air moves into and out of the lungs, the protective surfaces, we'll get into that towards the middle of this chapter, how your body produces sounds and how you can hear them with a stethoscope, and then how it aids the sense of smell. So first of all, we split the entire respiratory system into two parts, the upper respiratory system and lower respiratory system. The upper is just kind of what it sounds like. It's the very beginning up until the air actually exchanges with your tissues. So your nose, pharynx, trachea, bronchi, and then the bronchioles, which are just little bronchi. That's all the upper respiratory system. It's just a passageway for the air to get to your lungs. The lower respiratory system is lungs and further in. So it's the part where you're taking that air from the outside world and actually putting it into your tissue so your body can make use of it. Let's look at a picture. So the first part, the passageway from your nose down the pharynx, down the trachea to the bronchi. That's all the upper respiratory system. And then the gas exchange that is happening in each of these lungs is where the lower respiratory system takes place. So starting at the top, here is an actual human dissection of a nose, and you can take a look at this picture closer in the PowerPoints and identify the structures. The pharynx is separated into three parts: the nasopharynx, oropharynx. So remember that oro has to do with the mouth, so it's the closest part to your tongue in the back of your mouth. And then the laryngopharynx, which is the part that's closest to your larynx. One thing to point out here is that the pharynx is shared by the respiratory and digestive systems. So air and fluid and food all come through this part. At the bottom, you have this epiglottis that shuts off one tube from another. So you'll have your food going down one of these tubes, air down the other. This picture shows a little bit more in depth, a little bit more labeled, and you can see the larynx is labeled on this front part right here. The larynx is what produces the sound. That's where your voice box is. It's created by little vibrations, and if you have a chance to look at a video that's called The Incredible Human Machine, it's actually pretty cool. You can find it on YouTube. There's a part of it that shows Steven Tyler's larynx and his voice box, and it's just really, really cool. And you can watch these vocal folds that are flapping against each other. So you can see they're closed here, the white pieces, and open here, so allowing air to go through. To make sound, your vocal folds are going to open and close to create kind of a vibration that makes a certain pitch or a certain sound. The trachea is just a passageway. There's not much happening there. It's just a way for the air to get from one spot to another. But it's opened up with cartilage, and you can actually feel that if you feel along the front part of your throat. It's also known as the windpipe, and it's supported by those C-shaped tracheal cartilage pieces. Alright, from the trachea, we branch off into both the right and the left bronchi, which are leading into the lungs. From there, you'll branch off into even smaller ones that are called bronchioles. And sometimes they're labeled the main bronchus, right and left, and then we have a secondary and then tertiary. After those three levels of bronchi, we branch into smaller pieces called bronchioles. And this is a pretty sweet picture. Each one of these colors that's represented here is going to a different lobe of the lung or different section of the lung, and it's just really neat to see how tiny those pieces get. So even tinier, now we're talking microscopic. At the very end of those bronchioles, there's a little sac of what looks like bubbles. And inside those bubbles are pores that allow the air to move into your lungs so your body can make use of the oxygen. These little alveoli, as they're called, are the little bubbles. That's where the gas exchange happens. This is very important to know, so make sure you understand the concept of alveoli and what they do. Here's another even closer picture. You can see how the blood vessels and those tiny little capillaries are wrapping around the alveoli to take the oxygen out and to place the carbon dioxide back in from the used tissues. So just to reiterate, the alveoli are where the gases are exchanged through those surfaces. Carbon dioxide and oxygen pass freely, and one single capillary can be involved in gas exchange between several alveoli at the same time. So it's really just a big mixed up web so that you can get the most function out of those structures. Alright, as far as the lungs go, we have 3 lobes on the right, 2 on the left, and you'll note that there's fewer lobes on the left because we're making room for your heart on that side. The pleura are the 2 linings that are protecting the lungs from the other organs. The visceral pleura is lining the outside of the lungs. And outside of that is the parietal pleura, which is lining the inner surface of the body wall. So we need there to be a space in between that is called the pleural cavity. It'll make more sense when we look at this picture that's showing the pressures. So we have this dark red around the outside, that's the parietal pleura. The pink is going to be the edge of the visceral pleura, and the gray that's in between is the pleural cavity. The pleural cavity has its own pressure. It's called the intrapleural pressure, and right now it's 756 millimeters of mercury. Inside your lungs you have an intrapulmonary pressure, and it's 760 millimeters of mercury. As these 2 pressures are changing with a breath in and a breath out, it will cause you to breathe involuntarily. So you don't have to think, I need to breathe in, I need to breathe out. You're not thinking about that consciously all day long. It's the pressures between those 2 areas that are creating that constant breathing technique. So the pulmonary ventilation is the physical movement of air in and out of the lungs. The air wants to move from an area of high pressure to low pressure, and that is just a law of physics, not only with breathing, but molecules want to go from an area where there's really high pressure to an area of low pressure because it's easier. You would do the same. So pressure and volume are going to be inversely related, meaning when one's high, the other one is low, and if the other one goes high, the other one's going to go low. They're always opposite. And the diaphragm and rib cage are what's responsible for changing the volume. These next couple pictures help show that. So if you're ever having trouble figuring out how the events work with breathing, follow through these sequence of events and watch the pictures as it goes. And imagine it if you're doing this to yourself. So if you're thinking the inspiratory muscles are contracting, the diaphragm is descending, and the rib cage is rising. Try to do that. If you're raising your rib cage up, bringing it towards your chin, that's going to increase the volume of your thoracic cavity, which is number 2. Number 3, the lungs are stretched. The intrapulmonary volume increases. That means the volume that's inside the lungs is getting bigger. That means that same pressure has to drop because those are inverse. They're always opposite. That leads to air flowing into the lungs because it wants to go to the low pressure area. Now, if we're breathing out, this is expiration. The inspiratory muscles relax. That means your diaphragm is rising, your rib cage is descending or falling. So think about that. Your rib cage comes down. That means the whole volume is going to decrease, which is opposite of inspiration. The lungs will recoil. The intrapulmonary volume decreases. So the space in your lungs is getting smaller. which leads to an increase in pressure in number 4, and that eventually, as number 5 states, is allowing the air to flow out of the lungs, because now the pressure is higher in the lungs than it is in your external environment. So run through these steps a couple times if it didn't make sense the first time. Sometimes you just got to think it through, talk it out until it makes sense. I like these next couple graphs because it shows just how awesome your lungs are. In the middle, it shows a tidal volume. It's kind of this light blue aqua color. If you were just breathing a normal breath, just like you are right now watching this video, your tidal volume is about 500. That means you breathe about 500 milliliters in, you breathe that out. You breathe 500 in, breathe that out. If you were to take a deep breath and really go all the way to your entire ability, that's called the inspiratory reserve volume. So you are able to take in this entire amount, this 3,100 milliliters. And this can change a little bit for males and females, and depending on your age and if you have normal breath versus a disease that can affect your breathing. But these are averages, and it's really just amazing how much air you can get into your body. If you were to breathe all the way out until you physically cannot get any more air out of your body, that is your expiratory reserve volume. That's about 1,200 milliliters. And this last part right down here, the residual volume, that's the part that can never, ever, ever leave your body. So if you were to get all of the air out of your body, your lungs would shrivel up like an empty balloon. And that just doesn't happen. There's always going to be some amount of air to keep your lungs inflated. And there's also always going to be air within your trachea, because that never flattens out. It's always going to be there. So that residual volume is the amount that's not ever going to go anywhere. Okay, these are some more descriptions. I'll let you read through this slide on your own. It would be a good idea to know the averages for this top part: the tidal volume, the inspiratory and expiratory reserve volume, and the residual volume. Alright, as far as the transport of carbon dioxide and oxygen, you already know from the blood chapters that oxygen molecules are bound to the hemoglobin molecules. Carbon dioxide can be transported in the plasma or bound to the hemoglobin, and it can also be converted into this thing called a bicarbonate ion. We'll show you a little picture here. If you imagine this is the tissue that's using the oxygen, it's going to give the leftover CO2 back to this red blood cell. The red blood cell is dropping off the new oxygen so that it can be used in the tissues. And we have the opposite happening here. So this is the alveoli, where you're breathing in air from the outside world. You're going to give the new oxygen to the blood cell. The blood cell is dropping off the used CO2 to breathe out. Alright, last couple things. These are helpful charts that if you want to run through the organs on their own, general descriptions, what they're good for, and there's a second one right here. This one might be more helpful to describe the alveoli, those pleural cavities, and what they're actually doing. If you have any trouble with this chapter, let me know. I think it's one of the easier ones to understand, just because we've talked about some of these concepts before in other chapters. So as always, let me know if you have questions. Otherwise, enjoy your assignments this week.